Healthcare workers experience the highest rates of injury caused by workplace violence. That's according to the U.S. Bureau of Labor Statistics.
An increase in violence is weighing on an important and already taxing line of work. News 8 Now's Emily Haugen joins us in studio with a new bill Wisconsin lawmakers believe could help change that.
Mike and Amy, just this morning, lawmakers say their bill will protect frontline workers by holding suspects accountable. It takes a special person to work in healthcare.
They do it for that intrinsic motivation to help others.
But those workers are facing a challenge that runs deeper than their motivation.
In recent years, accident violence against healthcare workers have increased by 2/3.
From verbal assaults to throwing things, and then I myself have been struck. I know other providers have.
Dr. Chris Eberlein has seen an even greater challenge in the last few years.
When others harm them or threaten them, it makes them take a step back on perhaps why they're doing it.
Under current law, it's a Class H felony to batter a nurse, emergency medical care provider, or someone working in an emergency department. This bill takes it a step further, making it a Class H felony to batter or threaten violence to any healthcare worker.
It's about more than just actual acts of violence. It's the threat of violence that also impacts their ability to do their jobs.
At Gunderson, some steps have been taken to keep workers safe in tense situations, including de-escalation training and surveillance. But Gunderson lobbyist Nathan Franklin hopes this bill will add another layer of protection and care.
We would hope that this bill not only helps healthcare staff, but all people in service areas who are just trying to help others.
Roughly 20 legislatures have signed on as co-sponsors. It was introduced by Assembly Republicans, but has bipartisan support. Mike and Amy?
All right, thanks a lot, Emily. And that bill's first hearing will be held tomorrow.
Franklin says it could be signed into law as soon as this spring.